and welcome to this episode of Family Matters. My name is Purity Museo. According to the World Health Organization, about 10,000 health workers, frontline health workers, have tested positive for COVID-19 in Africa. And in Kenya, data released by the Minister of Health and even what the healthcare workers are saying, as of last week, about 500 healthcare professionals tested positive for COVID-19. And this includes doctors, nurses, clinical officers, and any person who is at the front line as far as healthcare providers is concerned, and 3 have already succumbed from this disease. So tonight, we want to have a look at how the frontline soldiers have been affected by this coronavirus. Over 17,000 cases now reported, and over 7,000 have recovered from this disease. So also knowing the kind of care that facilities are offering the patients is also important. And now help me welcome our guests tonight. Next to me, George Gibore, who is the Secretary General for the Kenya Union of Clinical Officers. Of course, he will be talking to us about the status of healthcare and especially clinical officers during this time of the response against coronavirus. And then at the far end is Austin Odwor. Austin Odwor is also a clinician, but most importantly, he is the president for the Global Association of Clinical Officers and Physician Assistant, a clinician who is also a COVID-19 survivor. Welcome, gentlemen, to the show, and thank you so much for making time for us.
Thank you for having me, Purity, on Family Matters.
Let me start with you, George. Let's talk about the status of the COVID-19 response as far as healthcare workers are concerned. We are talking about the treatment being offered, the kind of support that the healthcare professionals are offering, especially to those who have tested positive in the country.
Purity, as it is currently, majority of the healthcare workers, both the survivors and those who have not tested positive, are feeling that they are not receiving the support that they require. And this is quite evident in even a number of them who we have talked and how they have been handled once they have tested positive. The ministry has been promising and has been actually pronouncing itself that they have provided isolation centers for the healthcare workers. But once you test positive, that is not something that actually take the presidency. And we wish also to say, as you said, there are 3 healthcare workers who have succumbed. As it is today, it is stand at 8 healthcare workers. And it should be known that even the first time when the 2 healthcare workers had succumbed, when we announced it, the ministry denounced it and said we were wishing for them to die, but later on to concede the ground. It is reasonable that the ministry keep the data and update the country, because that is how you can be able, once you give the information, then you allay the anxiety among the healthcare workers. Remember what happened in the West African country when the healthcare workers felt that they are not being supported. They were leaving the health centers, and they decided to flee away from the health centers. This is clear, and of course we have to appreciate some of the bodies that we have seen, like the Equity. They have tried a lot to supply, but most of the time we must be able to say that, even as I have said, some of us who have not tested positive and are working in the lower facility, the dispensary and the health centers, they are feeling so much vulnerable because, one, the only PPE within their reach is only the surgical mask. And to such an extent...
talking more about the challenges. You've said the healthcare workers that have succumbed, the number is 8 and not 3. Maybe yes. How many have been infected? Is it the 500
yes.
that we know?
From as per yesterday, the data that we have is 531. And that is we will be able to look into the number that you have seen today, which is a big surge of 960. We get to see whether we still have other healthcare workers. And of course, I need to mention that you have seen even a number of 40 plus from one health center, from one facility. So it is reasonable to note that the number might be going high. As the number of the people testing positive in the country increase, the number of the healthcare workers being infected will still rise. And that is why the government must ensure that we are revisiting on the issues of infection prevention controls as pertained to the work-related environment. Yes.
All right. Well, let me welcome you, Odor, to this discussion. You are based in Migori, right?
Yes, I'm based in Migori.
Okay. So since the pandemic in March, how has life for you in terms of operations as a clinician changed? Are you experiencing a workload? Are you first at in the front line, the fight against COVID? I presume you are.
Yes.
So what has changed for you?
I can say that thank you so much for giving me this chance to be here at the KBC studios. Secondly, I want to say as a clinical officer in Migori, I can say that being a frontline health workers in Migori and Kenya at large, life has not been easy for health workers in general. And it's even worse in Migori and the surrounding counties. Because as clinical officers, we are the first people to see patients at the outpatient. And I've been working at the border. That is in Timaru Sub-County Hospital. Right now I'm at Isibania Sub-County Hospital. The border with the border between Kenya and Tanzania. So in the Tanzanian side it is Sirare, but on the Kenyan side it is Isibania. So being a clinical officer, to be specific, because I'm here courtesy of being a clinical officer and a health worker in general, we see patients at the outpatient. But then, me personally, I've never seen any clinical officer in full PPE at the outpatient. The only thing you can get is a face mask, which again, you have to beg for it to be given. So I see that is one of the challenges we've faced as clinical officers. Seeing patients, you see like 100 to 150 patients in a day. You work, the following day you still come back to work, and you see these patients, you don't know where some of them come from, some cross from the border. You'll never know which type of, which way they'll be using to cross those borders, but then it's a calling. We have to see the patients. So that's one of the major challenges that we've faced, and that's the same challenges that we clinical officers and other health workers who are frontline health workers are facing.
All right. You are a COVID-19 survivor. Maybe you can bring us to speed on when and how you got infected by COVID.
Actually, as I stated earlier, I've been working at the border town of Ntimaru. That is where I was working. Ntimaru is around 5 kilometers from the border, which is Gwetembe, in Kuria East, Migori County. So in March, when the first case was reported, it had not escalated that much. But then Migori started recording high numbers of COVID-19 cases. Most of them were truck drivers who were crossing from Kenya to Tanzania and vice versa. So there was an isolation center that was erected at Makalda, which to me was not even an isolation center. That was Makalda Sub-County Hospital, which was transformed to an isolation center, and patients were diverted to other nearby facilities. So the quarantine centers facilities were two by then. One was Mabera and another one was at the KMTC in Keancha. So again, the clinical officers and the nurses and the laboratory technologists were up to task. They were posted there. And I was working at Ntimaru. So first cases were reported in Kuria West, which is actually at the Isibania border. But when the first case was reported in Kuria East, they had to erect an isolation center 5 kilometers from where I work. So they had not posted clinical officers there. So I used to be picked by the hospital's ambulance to go see those clients at the isolation center. At times you're picked, you don't even have a mask. So I had to just go. Even I could even improvise a mask. It was so scary, but you know you have to go, because if you don't go, what happens next? You will get letters, show cause letters, things like that. So I went there, saw patients. It was not the first time that I was seeing them, because you have to do a round. You go to that facility, it's called Kwibancha Girls Secondary School. You see the clans there. You take BP, all those vital signs. Then you are dropped back to Timaru Sub-County Hospital where I was working. And it was not only me, because we are around 5 clinical officers. So the clinical officer who is on duty that is his calling now.
So you suspect that's how you got
So what
infected?
happened when I went for a training at the same facility, that training we were now being incorporated into that system so that we can now see those patients fully. One of the patients tested positive. That patient had seen earlier. He was hypertensive, so I was managing that patient. At that time, that was a client who was on quarantine. He had some history of travel from Dodoma, Tanzania. So I decided to take a self-test because I had interacted with that client. So I took a self-test on Thursday with some of my 3 colleagues, and on Saturday, when I was working, because I was doing night duties. So very early in the morning at around 8 a.m., I think I left my phone in the house, but when I came back, I found more than 30 missed calls. So I was being told, this is what happened. Austin, we're very sorry. You've contracted the virus. And I'm being told when I'm at the outpatient, seeing patients, with a face mask that I was given 4 days ago. So I saw it. This was so painful. But because I'm serving patients, I had to do that. So I was whisked. I was given time to arrange my things. So I was taken to Makalda Isolation Center.
All right.
Yes.
And you tell us what happened after isolation, being isolated. Is Gibore lack of adequate or even quality personal protective equipment the reason why more healthcare professionals are being infected by COVID-19?
Precisely. And I need to add up and say that, as you say it and put it very properly, is that we are lacking enough supply for the PPEs. And of course, the government need to come up with a prescription. As the leaders, we have prescribed and said that we need everyone in the health centers. Because one, the government still continue to focus in the isolation center, where they are directing all the resources, leaving the lower facility, which is the level 3 and the level 2, without any support. That's to mean, even when you see the contribution donation coming, they are geared toward the high isolation center and the level 4, and actually the referral facility. Leaving those who are working under the lower facility, actually the simple majority, without any support. And that one is exposing them because, one, they do not have enough mask to use. 2, they are supposed to have a cap which they cover their head. 3, they are supposed to have goggles that are supposed to use to protect them. And 4, they are supposed also to have an apron, and including boots. If you go to 80% of facility, they do not have these supplies. So when we say that they are getting infection, this is a big contributing factor. And the other thing is that a majority of them have not been trained. We are still focusing to train people working in the isolation center and relatively at the places where we feel that there is high risk. And still the high risk is said to be the level 4 and the referral facilities, which is against what is it, because now the disease is community spreading. Now, a majority of the people with mild infection, with mild symptom, they will be walking to the health centers and the dispensary, and they will not be going. And in any case, these are the facility within their reach. So that's where they go. And if now you have not protected the healthcare workers, they will be prone to that. Remember, you'll have actually a very low suspicion to any patient who is not exhibiting any symptom.
All right.
So hence the reason why the surge will be continuing. And there is reason, the government need to be reasonable enough to ensure that you focus to spread the resources and protect all the healthcare workers, because the huge numbers is coming from the facility that no one is thinking about them, and they have not been able to be supported.
All right. And you'll be telling us how big of a problem is this, what is available, and what should be an ideal working environment for healthcare workers during this time. But Odor, you tested positive. That was in March?
It was in May.
It was in May.
Yes.
And then taken to isolation. Were you symptomatic, asymptomatic? What happened until you turned negative?
I was asymptomatic.
Yes.
I had no symptoms. It was, as I told you earlier, it was a self-test. I decided to go for a self-test, of which most people, even most health workers, they will not want. because they are not prepared. They don't have the PPEs. They are like, how? Because the risk is too high. So when I was taken to the isolation center, I found my colleagues there. Actually, 80% of the health workers, all of them who were at the isolation center, were my colleagues. At first, they just took me, and they mixed us with other people who also turned positive. And that place was hell. It was like a small prison. I've never been to prison, but what people say outside there, that was like a small prison. The food, the diet, it was not that kind of. And then you contracted it in the line of duty. You were not even a contact traced. Someone who was being traced. I decided to take a self-test, tested positive. So I found one of my colleagues there. He was a laboratory technologist. He was also not very happy. We complained. You know, I'm a union official, national official of the union. So I was not happy there. I made a lot of noise. Then they removed us from that place after 3 days. Then they took us to one of the staff houses, which they turned to be now that, in quotes, the special isolation center for health workers. But you know, like Migori, I'm giving an example of Migori because that is where I work and that is where I come from. But even Kisumu, they were taking health workers to very nice hotels. At least you feel nice. You've contracted the disease in the line of duty. But now, you at least you be put in a situation where you can feel nice, you feel motivated, and with the issues of health workers also not being paid, the people who are also looking after us, who are my fellow clinical officers, my colleagues, the nurses, the laboratory technologists, they are also just taking the same food. These people, some of them, I don't know, it was even face masks was a problem. They keep on complaining, and if you look at the situation, even the surrounding, it was not easy. So I sat there, I was there, I was asymptomatic. I didn't take any drug in the entire 21 days that I was there.
You were there for 21
days.
Did you turn positive after 14 days? What happened?
At the 10th day, they always take a test.
Not 14th day?
The 10th day, when you are there,
okay,
they take the first test that 80% of the people turn negative. Actually, in that quarantine, in that isolation center, everybody had turned negative at that time. Unfortunately, mine was invalid. So they were saying, I don't know whether because mostly invalid is insufficient sample or what. They said that they were mixed up in my name. So they did another one, turned negative. So after that negative, it turned positive. My colleague also had turned positive again, but we were symptomatic. So again, after 7 days, I had to stay there for 7 days. 7 days, and then it turned negative, then negative again, and that is when I was released. And by the time I was leaving, we were around 11 health workers. And that time, home-based care had not, that speed that the government, the home-based care issue had not started coming up. So later on, some of the health workers were being told to isolate at home. But then, I can say that the county is not prepared. Even the people who are taking care of us, who are my colleagues, I will see that they are just straining and they're just doing that job because it's a calling. But even there is no, even the county team, no county team, the health team did not even visit me as a health worker, including the health workers who are there. They are not even aware, even calls, no one will call you, oh, please, Austin, this. You are like, it's a lone ranger. The only people who will call you are your colleagues who are from other counties, like my general secretary here, my branch officials. But then, it's like when you're a health worker and you contract it in the line of duty, you're thrown there, fight for your own self.
All right.
Yeah.
Gibore, sum this up. How big of a problem is this, that the healthcare workers are not being protected as they should? And what is available for the healthcare workers during this pandemic? And what should be? I know I'm combining so many questions, yes, but what is available for healthcare workers during the fight against COVID-19? And again, what should be an ideal environment for healthcare workers when you compare with other healthcare workers in other countries? What should be an ideal environment as we fight this pandemic as healthcare workers?
That's a very good question, and I wish to say that we are not alone in this. Kenya is not the only one that is facing the pandemic. And I wish to say that when we had the first case, It was unfortunate. I was also outside the country. I was in Malaysia, and they had 278 cases. To date, they register a single cases every week, every day, 0, 1, or even 3. What they have done, they did take it precisely and concentrated on the healthcare workers. Provide enough PPEs, training for the healthcare workers. We cannot be talking today here in Kenya, the 5th month, a majority of the healthcare workers have never been trained. A majority of the health centers do not have enough PPEs. And even after that, we said that we were to beef up the number of the healthcare workers we have. They actually agreed to employ 8,000, but to date, a number of the counties have not actually finalized the employment of these healthcare workers. And that is what has attributed to a lot of burnout. And actually, you look at today, a majority of the facilities that have had numbers of healthcare workers infected were closed down, including Pumwani. And we had also the one which is around here in town, Ngaira. And also, I think there are 3 now facility. I'm forgetting the other one. So when you close down a facility, it's a bad, actually, you are telling Kenyans that we are not able to offer services to you. And we have said employment enough healthcare workers, so that if there is cases like this, people should work in cohort so that the facility does not be brought to a halt because of a number of healthcare workers being infected. So, and of course the government must prioritize to ensure that we have enough staff to avoid burnout and of course to support them. The other thing I need to say is that the healthcare workers, why they are feeling a lot of anxiety, is about their risk, their life, their family, the people they serve. As he has said, that they were serving people without the knowledge, they got infected, they were still serving people until the day they were told you have tested positive. Did they follow up all the patient? Indeed. And of course, you know that the government currently is not announcing where we are in terms of contact tracing. It is maybe we have been overwhelmed. As beds are actually, we are filling our beds, facility are being overrun, and it will be very dangerous if the number of the healthcare workers continue being infected and it goes higher, and they are not feeling motivated as to feel that their risk is taken care of. Remember, even the president gave what we call COVID-19 allowance. It has never been paid to date, since actually March. It was to be paid with the month of April, May, and June. Not even a single county, not even a single healthcare worker have benefited. And we have lost some of them. They will never wake up to get the benefit of these allowances. So to date, we are still saying the government need to consider this. A majority of the healthcare workers do not have health risk allowance. They must get that. There are people who have been employed and have been termed as interns. They are getting only 15,000. And they are working like similarly to their counterpart who are on PNP. This is the kind of anxiety that we have built in the health system. And that is why the health system in Kenya is in test. And still the country is not able to focus and ensure that these are the things that are likely to ensure that they are promoting healthcare workers and ensuring the result. And of course, ensuring that we are able to work to protect Kenyans against the COVID-19. Mm-hmm. And we want to say, someone asked me today, are you planning to go on strike? And I want to reiterate and say, no. The situation itself will push these healthcare workers to walk out. And we are where we are. I think last time I appeared here, I said we do not have any curve we are protecting, that we want to bring down. It is now that we are building the curve. And this curve, as you can see, is actually a big danger to us. And it is a warning to Kenyans that we need to focus to support the healthcare workers, to do what they are supposed to be doing, to ensure that we can be able to protect Kenyans.
All
and
right.
Simply, maybe if you allow me,
yes,
there is low cost measures that we can be able to do. Provide surgical masks to every healthcare workers. Provide them with aprons. Provide them with goggles. Provide with them with caps. And ensure that every patient with any signs and symptoms that could be more of flu-like, that could be suggestively to be COVID, must be given a surgical mask between the time that they are in the hospital Mandarin. And we have to ensure that all the healthcare workers have been trained and employ enough healthcare workers and motivate them with what they are demanding, like the health risk allowance. This will be ensure that the healthcare workers are working without tiring.
Okay. Odor,
yes.
After testing negative twice and you're released to go home, did you go back to work? Did the environment change, or how are you coping?
I shifted from the earlier hospital where I was.
Yeah.
So I took 2 weeks. I was just at home. I was in my house just relaxing and trying to monitor the situation because I was asymptomatic. Then I went back to work after 2 weeks. But you see, because that is Migori's perspective. There is something that I really wanted to put to stress. A county like Migori, the county government has withheld clinical officers' salary, 2-month salary, for now, at this time of COVID-19. The clinical officers, majority of them who are seeing these patients, who troop from the border, you withhold someone's 2 months salary, and you expect this person to work with that vigor and stigma and that vigor when seeing patients. Yet this person has not been given 2 months salary. So that is one of the greatest undoing in the county where I work, where the Minister for Health has just refused to pay us our 2 months salary. More than 4 clinical officers have contracted the virus. This is someone you've not paid his 2 months salary. You still owe this person's 2 months salary. The risk allowance has not been paid. No, not the risk allowance. The COVID-19 allowance has not reflected in the account. But then you want this person to work, to see patients. So I rested for 2 weeks. Then I decided to report to work. Right now I'm currently working at Isibania Sub-County Hospital. Yes.
And did that affect you psychologically, that now when you're coming back to work, are you more careful, because most of the things or the information that we are getting, especially from the Minister of Health, is that you have to protect yourself, you have to wear the mask, you have to wash your hands, and it's kind of like it's a personal responsibility. So did this whole experience make you become more careful, or how are you dealing with this?
Yes, in fact, now I'm a champion. From next week, I'll be moving from the villages in Kuria East and Kuria West, talking to residents, telling them what they need to do to prevent this COVID-19. And what the challenge, as I said earlier, is the issue of the PPEs at the outpatient. There's still shortage of face masks. I saw Equity giving PPEs. I don't know where these PPEs always go to, because they never reach us, and you beg to be given even a face mask. But now I've decided to be a champion to like now health promotion. I have to walk around the villages, trying to sensitize the community, because this thing is spreading in the communities. And at the border there is that border line from Nyatike sub-county towards Narok. That borderline is very, very risky. And then that is now, because I'm working there, so I need to move around and sensitize the community.
Yeah.
Yes.
And we are winding up. In a minute, maybe, to emphasize on the role of clinical officers, because most people think the response is about doctors, it's about nurses. What role do clinical officers play, or are they playing during this time of the pandemic?
I want to say that clinical officers, and you mentioned there that I'm the president of the International Association for Clinical Officers and Physician Assistants. Yes, our headquarters is in Ghana, Accra, Ghana. Clinical officers in other countries, they are called physician assistants. In the United States, in Europe, and other people also call them with different names. The role that clinical officers play, clinical officers see 95% of patients. So actually, 95% of the population in Kenya are under the control of clinical officers. Not even in Kenya alone. Uganda, Tanzania, Rwanda, Burundi, all those countries. So there is that need that the government should recognize what the clinical officers do. Most of the people don't know who a clinical officer is. Very, very few people. We've done a lot of sensitization to tell the public who we are. Because what we do, look at what happened in Sierra Leone, Liberia, during the Ebola crisis. It is the clinical officers. Our own chairman, Peterson Washira, led a group of health workers, and what they did there was marvelous. Look at Uganda. Uganda is more prepared to handle COVID-19 with only 1 case of death, and they are doing that because those who are in the front line there are the clinical officers. They did wonders during the Ebola crisis in DR Congo at the border there. So clinical officers, they are doing a very good job, and the government should employ them.
I'm being told time is not on our side, honestly. I know you're quite shocked, but will you do with 20 seconds?
Yes, please.
Please, parting shot, kindly. 20 seconds. Make it 20 seconds.
First, thank you for giving us opportunity to tell Kenyans what we are feeling as healthcare workers. We will wish that none of us actually succumb to this disease, including all the Kenyans, because those are the people who make us to be in the facility. And we wish to implore the government to relook and reconsider and prioritize the issues of health and focus on the staffing. And of course, ensure that they are meeting their demands in time. Like those which have been mentioned that they have not been paid, we are saying that we are working there because I have moved around and I have found a deplorable situation in the county. And the majority of the healthcare workers is like, they are working like there is no COVID. And even when Kenyans are working there, they have got no mask. We are being actually exposed, and it is only, we are actually sitting on a time bomb. Thank you very much.
All right, we'll have a discussion, the same discussion, maybe for another show soon, because frontline workers are the ones leading the fight against coronavirus, and it's important we bring out these issues, even as we look forward to having them addressed. Thank you so much, George Gibore. Thank you so much. You know, I'm so honored that you came all the way from Migori County.
Maybe my parting shot.
Yes.
I want to say that this disease is real.
Yeah.
We should take care of ourselves. We should follow the government directive. But then, as I conclude, clinical officers are the champions, and the government should employ them. We need 30,000. And
thank you for your commitment. Yani coming all the way from Migori County just for Family Matters show. Thank you so much.
Thank you so much.
God bless. All right, and that brings us to the end of Channel 1 Weekend, and of course, Family Matters show. Thank you so much for tuning in and for watching. My name is Purity Museo. Byron Abuli has been our sign language interpreter tonight. Thank you for your feedback. I'll be going through them off air. Yes, do enjoy the rest of our programming and a great week ahead. God bless.